Hey, what's up, future RNs and healthcare professionals? This is my return demonstration on how to administer medication through certain routes. Before actually administering the medication, we must always assess for the following. In order to prevent many medication errors, we must always observe the 10 rights in giving medications. Check if you're giving the medication at the right time and if it has the right name, and if you're giving the right dosage through the right route. Ask the name of the client and check his or her ID band before giving the medication. Provide enough knowledge to the patient of what drug he or she would be taking and what are the expected therapeutic and side effects. Give the client enough autonomy to refuse the medication after thoroughly explaining the effects. Secure a copy of the client's history to drug interactions and allergies. Review any medications previously given or the diet of the patient that can yield a bad interaction to the drug to be given. Check also the expiry date of the medication being given. Make sure to write the time and any remarks on the chart correctly. After observing the 10 rights in giving medications, do hand washing before and after the preparation of materials. And then you can proceed to identify the client, introduce yourself, explain the procedure and the actions of the medication to the client and relatives. Place the hypo tray on the bedside table, and then provide for the client's safety, comfort, and privacy. For the first procedure, we will be administering eye medications. Apply 70% rubbing alcohol and then put on your gloves. Clean the eyelid and eyelashes from inner to outer canthus using one stroke in each eye. Be careful to use a single gauze in each eye. Open the medication drop, tilt head backward, and then instruct the client to look up and expose the lower conjunctival sac by depressing it with your non-dominant hand using your thumb or index finger. Using your dominant hand, hold dropper 1 to 2 centimeters above the conjunctival sac and instill correct number of drops. Instruct the client to close eyelids but not to squeeze them shut, and then press firmly at the nasal lacrimal duct for at least 30 seconds. Guys, be careful and remember to use a different gauze when pressing the patient's eye, okay? Next up, administering oral medication. Apply 70% rubbing alcohol. It's alright to make chica with the client if he or she is feeling kind of nervous. Offer the medication to the patient. Give one capsule or tablet at a time if there are more than one medication to be taken by the client. Give the client sufficient water or preferred juice to swallow the medication. Offer a straw if the client cannot drink directly from the cup or glass. Assure that the medications have been swallowed by the client. And then, through the sublingual route. If your client is shy and wants to do it themselves, you can instruct them on how to administer sublingual medication on their own. Apply 70% rubbing alcohol and then give the patient their medication. Watch and make sure the client puts the medicine underneath their tongue. Tell the client to hold it in place and tilt their head forward to avoid swallowing the medication, and to hold the sublingual medication under the tongue for at least 10 minutes. And then we have administration through the buccal route. Similar to sublingual medication, if the client wants to do it themselves, you can instruct them on how to properly do it. Apply 70% rubbing alcohol, give the medication to the client, then watch and make sure the client places the medication in the buccal pouch between the cheek and gums. Advise the client to avoid opening the mouth, eating, talking, moving, or standing during this time to ensure that the tablet doesn't move and has time to dissolve completely. When administering nasal, ear, and eye medications, don't forget to rub alcohol on your hands and put on your gloves. Here we go towards the ear root. To ensure the client is comfortable, assist the client to a side-lying position. Clean the pinna of the ear and the meatus of the ear canal. Warm the medication container in your hand for 10 seconds or place in a warm water for a short amount of time. Straighten auditory canal by pulling the pinna, for children downward and backward, and for adults upward and backward. Instill the correct number of drops along the side of the ear canal, and then instruct patient to remain in side-lying position for about 5 minutes. Insert a small cotton fluff loosely at the meatus of the auditory canal for 15 to 20 minutes. Do not press it into the canal. Don't forget to make tanggal your bulak. And then we have nasal medication. Offer gauze to the client and have them blow their nose. After blowing, dispose the gauze into the garbage bag. Assume supine position and with head tilted back, hold the tip of the container just inside the nares and instruct the client to inhale as the spray enters the nasal passageways. In children, medications are given in upright position to prevent excess spray from being swallowed. After each procedure is done, provide for the client's comfort, safety, and privacy. Dispose all used materials and rearrange the reusable ones. Remove gloves and do hand washing, and then assess for the effectiveness of the medication given. And then, don't forget to document the procedure and the client's reactions on the client's chart. That's all for today, folks. Thank you for watching, and here's a little swirl from me to you. Hala, si bakla, naaning na. Ayun, ano kaya? Ay, oh my goodness. Bye! Thank you for watching. This is Hannah Marielle Cruz from BSN 1-6.